Muy buenos días, sean
Good
todos bienvenidos
evening. Welcome you all
a esta segunda sesión
to this second session
de nuestro webinar.
of our webinar.
Siguiendo con la dinámica,
Following with the
hemos
dynamic that we had
iniciado
yesterday,
con la doctora Patricia
started with Doctora Patricia Redondo. After the
maestra Paula Álvarez.
presentation of Maestra Paula Álvarez, we will continue with these experiences within different countries and contexts to integrate these principal stakeholders of work relations, including occupational researchers. We remind you that the recording will be available in our website of CAPRT. We will be sharing to you the link in the chat. And at the same time, we will share all the materials of these two sessions. At the end of this session, we will have a small time of question and answers. So we invite you to leave all your questions and commentaries in the chat. To start the second session, we have the presence of Doctora Irma Juárez Pérez, and I'm going to present her. The doctor holds a bachelor degree, a PhD in business management. She has a master's degree in occupational health and safety by the Institute for the Development of Occupational Safety and the Ministry of Labor and Social Welfare. She has several diplomas in research and education with an integral approach for occupational health workers, occupational health care, planning and safety at work, as well as senior management in health service care. It is certified as a quality auditor in labor competence instructors, in quality management systems and leadership, and she has been coordinator of work safety at the Mexican Institute of Social Security and teacher at the Postgraduate Center of the State of Mexico. Since 2020, she has been the academic coordinator of the Inter-American Center for Social Studies. Her trajectory, it is very important, and we have her here to open our event. Thank you very much, Doctor, for your generous presentation. I would like to greet you all, the colleagues that today are with us and the public and general public. Greeting from Dr. Daisy Corrales Diaz, Director of the Inter-American Center for Social Security Studies, an institution of teaching, research, and training. Today, on this morning of the 26th April, we will continue the webinar, Safety and Health at Work 2022, with participation and social dialogue in order to build a positive safety and healthy health culture. In its second day of activities, and in accordance with the World Day for Safety and Health at Work, under the slogan, Acting Together to Build a Positive Occupational Safety and Health Culture, this is to recognize and celebrate all of the workers, present and absent, who through their work performance have contributed to the construction of our society. I would like to ask you, therefore, a minute of silence for all the workers who have died when working.
Muchas gracias.
Thank you very much. In this year in particular, when we are still facing the epidemiological crisis and and of the relevance of envisioning in pro of a prospective planning for the improvement of post-pandemic working condition, I would like to stress that in a volatile, complex, uncertain, ambiguous world, preventive occupational health and safety programs are need to be implemented from a holistic and integral perspective of all its stakeholders. In this panorama, in this world panorama, uh, business as well, we have all the stakeholders as governments, employers, workers. After this pandemic, we have the experience of all that. Also, we have to take into consideration the stakeholders of public health. We see in this tripartite panorama, we need to envision, so it turned four parties, stakeholders, and all of them have its needs, its specific needs. The government has its needs. Providing this integral project, we see that we have to prioritize human factor as a fundamental element for the productivity. Through this, the productivity of the enterprises, the employers have its own needs, but they also have human capital as a main source for the development of the enterprises. So they be sustainable. The workers have all the needs that we see when they have their own expectations, and they have work through prevention. Workers are not a number. Workers go to the organization and develop the activities that sum up as a human capital of the sustainability of the organization. They also have their own expectations and needs. And we as preventionists have to make a stop, and through the human factor and with security in its work environments, we can have as a proactive way the fulfilling of all the preventive programs. The root cause of all the risks is from this worker that is not comfortable in the organization. And of course, he's not going to act in these preventive activities. And it is very important because the workers are vulnerable in this pandemic context. So working together with the workers is going to be really important. All in this environment, sum up with all the public workers, it will help us to build a culture of safe and positive health at work. Therefore, having as a fundamental element this human factor, we are looking that this system of social security and health at work is strong, functional, not theoretical. We've had a lot of theoretic, but I reiterate that if we don't work from the root cause in the promotion and prevention, we will have to deal with the risk with the work days. So in order to have this balance, we need this balance, this diagnosis and centered in the human factor in order to prevent risks under the self-care of its own health. We see that these preventive programs require leadership. And leadership, we are in the precise time to have these three structural levels under the responsibility of its own leadership. If we apply as preventionists this change of mentalities, of attention to human factor with an implementation of preventive functional programs and under a social efficient dialogue, we will have an active participation of the three organizational levels: operative, in medium, and high management. That is the ideal. In this moment, we will be anticipating, we will be recognizing those work risks from the root cause, and we will evaluate those risks, and we will be able to control them. It is when we are going to create a preventionist culture, the ideal and the expected, and that in some all the preventive focus, we will be generating safety and health work environments from within these three levels. Respecting the times, let's act together. So we can build a culture of safety and health at work, favoring all these work environments that's gonna save the healthy of our workers that nowadays are in the front lines, in the mines, in the fields. We are envisioning all the improvement for all the workers to be balanced. Welcome us. So welcoming all, invite. I give the floor to Dr. Graciela Gir Montalvo, CAPRT president, compromised preventionist, professional prevention specialist preventionist. It is a very special week in the world because without the workers, without the preventionists, I don't want to be catastrophic, but we wouldn't have societies. Therefore, all my greetings, Dr. Javier, a relevant specialist in the Americas. We are making you a recognizing in this very important week. Doctor from Mexico, cordial greetings, and I give you the floor. Good evening. Thank you very much for this brilliant introduction, Dr. Irma Juarez, Academic Coordinator of CS. Having with you is a privilege. And all the participants, welcome to the second session of this webinar on social security that commemorates this 28th of April, World Day for Safety and Health at Work, for the ILO, acting together to build a positive safety and health culture. Yesterday, we had the privilege of the participation of Maestra Paula Alvarez Reparaz, a representative of ILO, who developed the topic on the social dialogue and participation of the workers in the management of work health at work, and all the agreements that the majority of the workers of the countries know, where the scenarios, the tripartite scenarios are strengthened within the framework of the workers' right. A very important aspect highlighted by Dr. Alvarez is that the fact that in the polls made for the workers, the results highlight the intensification of negotiations during COVID-19. And within the main causes, a lot of would feel identified as part of this negotiation, where this aspect that prevention is work, risk assessment, vaccination, telework, lab tests. It's also worthy to remember that information, social dialogue, and negotiation between these three parties are keywords in the definition of ILO, considered as necessary in the work, justice, social justice, and economical growth. This considering that the same entity has said that accident at the work suppose a 5.4% of GDP worldly. Also yesterday we listened Doctora Patricia Redondo, who shared the Costa Rican model, a management for countries with similar economies, who's it's really relevant. Doctora Redondo explained presented all the scenarios that they have for social dialogue from within. It is, for example, the Occupational Health Council as a technical organism in order that has to develop this social dialogue. This council is also important that management risk assessments is really important, which we support as an American Commission on Occupational Risk Prevention. And something really interesting, the training on safety and health at work that starts from the scholarly level. To conclude, the American Commission on Occupational Risk Prevention want to express you in this scenario that if these legal figures on social dialogue are present in the majority of our countries as the tripartite commissions, the parity commissions, or mixed as scenarios that develop these efficient safeties. A lot of our countries that have a culture on safety and health in development, we have still challenges to have a successful negotiation. We want to motivate our countries, all the national policies on occupational safety and health, especially those directed to micro, middle, and small enterprises companies. So we want to propose all the programs of training, widen all the academic, to provide tools to help to dialogue and negotiate. It is required information and training on occupational rights. Without further to say, let's continue to listen the experience and good practices in social dialogue and work environments that influence. And we are happy to listen for all the countries who have a history of workers' fights. friends and professional of occupational and safety health. Dr. Garcia. Thank you very much, Doctora. We thank the presentation of Irma Juarez and Doctora Irma Gil, our president of the American Commission on Occupational Risk Prevention, to state so punctually the event of yesterday's event and the continuation of today's session. Precisely in this intention to share experiences, we have today three panelists, three very important panelists from the US, Colombia, and Argentina, who are going to present us their experience on this topic, on social dialogue, for the improvement of safety and health at work. First of all, we have the speech of Maestro David Legrand. David Legrand is Labor Outreach Coordinator for the Healthy Work Campaign. He's also a research associate and board member of the Center for Social Epidemiology. He has more than 50 years of work experience in the US labor movement, and it is a fundamental piece of labor movement and will be integral to our outreach to labor movements, organization, and worker advocates interested in addressing psychosocial work stressors and using the Healthy Work Survey and other health work survey tool resources. He was a business representative at the Service Employees International Union and the Amalgamate Meat Cutters of North America. Later, he accepted a position as Occupational Safety and Health Director at the Communications Worker of America. This position he held for 40 years until his retirement in 2018. During his work at CWA, he focused on numerous problematics such as ergonomics, including work organization, occupational stress, and health symptoms and illnesses, and other issues related to chemical and hazardous materials, indoor and air quality and design, as well as occupational and environmental safety and health, regulatory and legislative effort. It's a real honor to have you here, David. I will give you the floor. Muchas gracias. To reject the presentation.
Psychosocial hazards and improve work organization. Next slide, please. Next slide, please. The Healthy Work Campaign, a component of the Center for Social Epidemiology, has as its primary focus the reduction of harmful workplace stressors and improving job quality and health, or as I often like to think of it, working conditions. Next slide, please. Why occupational stress? Well, some of the reasons: 1 out of every 3 American workers say they typically feel tensed or stressed out during the workday. Those working 11 or more hours per day are 2 to 3 times more likely to experience depression. Low job control increases the chance of death by almost 45%. Lack of fairness increases the odds of having a physician-diagnosed illness by 50%. And 10 to 20% of all causes of cardiovascular disease deaths among working age people may be due to work. Next slide, please. Let's look at the etiology of occupational stress. We know that stressors occur as a result of hazards or threats. We as individuals, when we encounter stress, develop a fight or flight response, a natural reaction, and often develop short-term health effects. For example, increased blood pressure and heart rate, muscle tension, shortness of breath, feeling shaky or achy. As stress continues, we feel job strain or distress, and often long-term health effects, such as headaches, sleep disorders, exhaustion, musculoskeletal pain, mental disorders, high blood pressure, and cardiovascular disease. Next slide. Now let's look at some of the sources of occupational stress. We recognize these on the screen. I'm sure many of us have experienced these in one way or another. Precarious work or non-standard employment and job insecurity, low supervisor support, work-life imbalance. The importance of balancing out efforts and rewards is substantial. Long work hours, bullying and harassment, and highly demanding work and low job control. Next slide, please. Jeffrey Pfeffer of Stanford University, in his book, Dying for a Paycheck, presents 10 major work stressors: demands, low control, low support, long work hours, shift work, work-life conflict, lack of fairness at work, unemployment, job insecurity, and lack of health insurance. Occupational stress, according to Pfeffer, leads to approximately 120,000 deaths per year. That is substantial. In fact, it equals some 5 to 8% of the annual healthcare costs in the US, some $180 billion per year. Next slide. What is the Healthy Work Survey? The Healthy Work Campaign, again, a component of the Center for Social Epidemiology, developed this free online tool. The survey itself identifies work-related stressors or sources of stress at work or psychosocial hazards based on the firsthand knowledge of workers. We have seen the survey is scientifically accurate, developed in collaboration with university researchers, including questions from National NIOSH and CDC Quality of Work-Life Questionnaire. It takes some 15 to 20 minutes to complete. It's anonymous, secure, and confidential, a key issue for workers. And upon completion, a free automated anonymous report is available for individuals and organizations through email. The report compares scores to a nationally representative survey of US workers. Next slide. What does the Healthy Work Survey measure? Well, let's go through them. Job demands, for example, workload, time pressure, resource adequacy, job control, use of skills and decision-making, supervisor support, coworker support, rewards, work-life balance, safety climate, work arrangements, precarious employment, workplace injustice, again, bullying and harassment, emotional labor, physical environment. We also included questions specific to COVID-19, and identified several self-reported health issues, such as exhaustion, back pain, injuries, obesity, depression, high blood pressure, and diabetes. Next slide, please. The Healthy Work Campaign initially identifies a local union or a union representative. We explain the purpose of the Healthy Work Campaign and the Healthy Work Survey to the individual. And then we develop a program together. A unique and confidential link to the online Healthy Work Survey is emailed to a union representative with guidance about how to administer the survey. Oftentimes that's the local president or a key bargaining committee person. After as many participants as possible, and we of course focus on a 50, at least 50, but hopefully 70% participation rate, complete the survey, an automatic aggregate group level report is emailed within 1 to 2 days. The report shows how the results for a particular organization or group of workers compares to risk scores on major work stressors from the NIOSH QWL National US Population Survey. Next slide, please. This is a bit of a report from one of the projects we've been involved with at the Healthy Work Campaign. I'm going to highlight 2 areas on this slide. First, work stressors on the left-hand side. In this particular investigation, we found that 39% of the participants reported high demands, 48% high workload, 47% low job control, 40% low decision-making, 33% low supervisor support, 44% low promotion opportunities, and 51% high emotional labor. Now, we as occupational health specialists know that when people experience and report these kind of work stressors, we would anticipate seeing health issues reported. So if we go to the portion of the slide towards the bottom, we see the health issues outlined. Indeed, 12%, I'm sorry, back to that slide, please. The previous slide, please. Yes, we see 12% of the participants reported physical health was not good within the last 14 days. Mental health was not good by 30% of the participants within the last 14 days. 32% reported depression, 51% reported burnout or exhaustion very often or often. 42% reported trouble sleeping often, and 52% reported stressful work very often or often. Next slide, please. We investigate and include, as noted, psychosocial risk factors, and you'll see them listed here as high demands, high workload, low resources, low job control, low decision-making, low skill utilization, low supervisor support and low coworker support, work-family conflict, low rewards, low promotion opportunities, and low safety climate. All these factors have been correlated to the occurrence of occupational stress. As you'll see in this particular report, we identified a significant number of the participants reporting high risk in a number of categories, demands, controls in particular. Next slide, please. We also measure workplace justice, civility, and request, particularly in the form of bullying and sexual harassment. Next slide. I point out this slide in particular because of the pandemic that we've been dealing with for more than 2 years. Workers reported in a majority 53% suggested that they were not aware of the employer having an infection control program. And 58% of the same group reported they did not feel sufficiently trained to put on or take off their personal protective equipment without contaminating themselves or others. We asked another question regarding psychological health, and 53% of the participants reported they would rate their psychological health and safety climate in the workplace as toxic, fair, poor, or not so good. Again, all issues that would lead to occupational stress and health effects. Next slide, please. We also look at health issues, just to highlight general health, physical health, mental health, burnout, exhaustion, sleep factors, and stressful work. Again, factors that we would look at when we're trying to identify occurrence and causation of occupational stress. Next slide, please. This was a pilot test done with a local within the Communications Workers of America, my union, that I was health and safety director of for some 40 years. This was a local in Northern California. The Healthy Work Campaign approached the local president, presented the campaign to the local president, and her executive board in turn developed a proposal to initiate the Healthy Works survey with the membership. Again, an online survey. It was conducted last year during August. We had a 51% participation rate, with 55% of the participants being male and 68% being between 45 and 64 years of age. We identified that this population was similar to all members. With the collected data, we translated the findings into a report, met with the local president, the local bargaining committee, and suggested ideas with their input as to how to resolve occupational stress factors that we had identified, in addition to the health issues we had identified. In turn, that initiative was turned into a set of proposals that we delivered through the Joint Labor Management Occupational Safety and Health Committee, composed obviously of both union and management representatives, suggesting change and improved working conditions. I'm happy to report that the employer took our suggestions to heart, and at present, the union and the company, through the Joint Labor Management Health and Safety Committee, are presently working to eliminate the stressors and improve worker health. Next slide, please. The Healthy Work Campaign, and again, the Healthy Work Survey is a product of the Healthy Work Campaign, has developed strategies and resources showing examples of contract language, collective actions, laws and regulations that have helped to reduce workers, and also tools with steps to follow to engage members in addressing work stressors to improve health, safety, and well-being, all with the idea of identification and prevention of occupational stressors. Next slide, please. We might look at the work we do with the Healthy Work Survey in consisting of three different phases. Phase one is identification and assessment. After we've approached the union with a program using the Healthy Work Survey, we bring the union on board, so to speak. We try through the collective bargaining process to get management buy-in. That sometimes works and sometimes is not so successful. Then we email the Healthy Work Survey link to the local union president, and in this case, she sent the link to the membership for completion of the survey. As we collect the data, we translate that into a report, and then we review and we share the findings with the local president, other members of the executive board, and other key union folks. Where we have management buy-in, we also present that through a labor management committee, oftentimes the labor management health and safety committee, or a collective bargaining committee. Our third phase is to take the findings and the meetings with management to further identify the committee structure within the union for the purpose of prioritizing findings, setting goals, and further developing an action design proposal that would be presented to the employer for implementation. Throughout this process, we emphasize to the union, and the union wouldn't be involved unless it was already doing this. We emphasize maximum membership input and engagement. Next slide, please. Through our work in the Healthy Work campaign, we've developed several healthy work strategies. This slide demonstrates some of the industries where we have done that, as well as some of the unions within the healthcare industry. We've worked with the New York State Nurses Association to improve safe staffing levels, a huge issue in the healthcare industry. Within manufacturing, we've worked to achieve better work-life balance. Within education, particularly with the American Federation of Teachers, we've worked to reduce workload and increase job control. And within the transportation industry, with the Amalgamated Transit Union, to reduce work stress among bus drivers. Next slide, please. In addition, we have developed case studies demonstrating how to reduce and improve work stressors. For example, improving work-family balance. One particular focus was work-life balance and trade unions. For those of you in the labor movement, you know how we don't normally work an 8-hour day when we're in a leadership capacity in the union. Sometimes in a bargaining unit position, we end up working more than an 8-hour day as well. We need to be able to balance our work and life matters in order to avoid occupational stress and stress away from the job as well. We've worked on reducing bullying by developing a respectful workplace policy and contract to reduce workplace bullying. We work to reduce high job demands, for example, laws to improve nurse staffing levels in hospitals in the US, job control, increasing job control among call center workers. That's a specific interest to me. CWA, Communications Workers of America, I should say, represents thousands upon thousands of call center workers. We also work to end sexual harassment and violence, particularly as an occupational stress issue, suggesting the development of panic buttons to prevent psychological trauma and physical assault among hotel housekeepers. And finally, we work to relieve COVID-19 work-related stressors by, through the data we presented, developing collective bargaining proposals to reduce related work stress. Next slide, please. So all of this information I've presented today is presented under the focus of the Center for Social Epidemiology and our Healthy Work campaign. Further, it's available through our website, healthywork.org. Again, our primary goal is to reduce harmful work stressors, improve working conditions as well. And I'd like to close by by remembering the famous words of a famous U.S. union organizer, Mother Jones, as we approach Workers' Memorial Day. She reminded us to mourn for the dead and work like hell for the living. Thank you. I appreciate it, and I welcome questions later.
Maestro David Legrand, muchísimas gracias por...
Thank you very much, Maestro Legrand, for your presentation. Maestro Legrand gives us a perspective and an experience of how to integrate coordinately all the stakeholders to obtain data and take decisions based on evidence. This is very important in order to the intervention that we pretend to do it at the workplaces have a real effect. It is clear for us that accidents has a deep meaning in the health of the workers. Nonetheless, Maestro Legrand allows us to show the relevance of the factors that have long-term consequences in the workers' health, but also in the organizations and the work environment. As Dr. Legrand said, all this information of the project of the Healthy Work campaign is in the webpage of the same campaign. We already share. My colleague Diego Terán shared in the chat the link. This Healthy Work campaign is making an effort. As you can see, it's a project that started in the US, but they are making an effort to translate all the materials available at the webpage. The questionnaire is still in English, but I've understood that soon we will have the Spanish version. David, thank you very much for your presentation. So, as well with this topic, it is clear for us that the pandemic, as we all know, have demanded that all the stakeholders of work environment give an answer, an immediate answer to keep the economy active. One was the telework topic that we have already discussed in these spaces, but Dr. Álvaro Javier Hidrobo Velandia, it's going to share us a perspective of an experience, a very interesting experience they have in Colombia. I'm going to read his CV. Dr. Álvaro Javier Hidrobo Velandia is medical surgeon, specialist in occupational health and hygiene, magister in public health, as well as environmental sciences, and a PhD in epidemiology. He's currently professor of the Department of Public Health in Medicine School of the University of Santander in Bucaramanga, Colombia. He's also senior researcher. He has more than 20 years of research experience on occupational and environmental health, including teaching in Mexican and Colombian institutions. He has published more than 100 scientific articles on various topics, highlighting research on adverse effect on pesticides, metals, and metalloids in agricultural and mining context. He has also research on organic solvents, public health surveillance, solastalgia, meaning the sadness of environmental losses, as well as on various other topics on sociocultural epidemiology. It is a great pleasure to have the presence of Dr. Álvaro Hidrobo. Go ahead, Dr. Hidrobo. Good afternoon to all. Thank Javier for that generous presentation. Let's going to take advantage of the time. I was telling Javier that I'm about to start classes at the university. So if you help me indicating me if whether you are seeing my presentation,
No la vemos en pantalla completa.
we are seeing it, but not.
No me deja, no sé qué está. Ya, permítanme. Ok, creo que ya.
Correcto.
Bueno, lo que les voy a presentar el
I'm
día
going
de
to present today.
experiencia
It's an experience that
exitosa
was successful
que después incluso
and that after
científico en
it has
momento
its scientific
como
proof.
tal fue, digamos, alguna respuesta
It was an immediate response of a empresarial group that incorporates different sectors of the economy, but they are of the same owners that have that in different 7 cities of the country. I'm not going to say the name of the institution because they haven't allowed me to say it. We have already 2 scientific publications, but I'm not authorized to present the name. So I would like to say that it was an idea, a very interesting idea that came up of a very interesting discussion with the management of this enterprise. Let's check what they've done, which was to have some elements to act in the midst of the pandemic with an occupational specific health for this kind of emergency that we wouldn't have. Let's make a context because we have people from a lot of context. Colombia was really affected, even more than other countries, but not because the informal sector is really big and it is a very strong problem. In general, what we saw in Colombia is that pandemic was understood as a biosecurity problem, and in that sense, it was acted immediately as what we've already know as biosecurity. We intensified hand washing, use of masks, and other measures, cleaning floors and objects. That was the first step that we made. This group realized quickly by the local decision that quarantines and isolation, an infected isolation person, were against the productivity of the companies. So they asked, what can we do? And in this sense, I arrived with a consolidated group, and we were able to organize this. In Colombia, I want to tell you that this is a group, an empresarial group that have very diverse activities. They produce food and for animals and for people. They have technical support, for example, in the metal mechanical sector, building, transportation, security sectors, all within this group. In Colombia, at the beginning of the pandemic, everything was almost closed, at least that they consider essential the activity. And in that sense, all this, the enterprise of this group that were dedicated to the production of food, they didn't stop because they were considered essential and they keep working. That is the basic context. So let's see how the pandemic was. The red marks at your left. We have the name of cases at that moment, and at your left, the name of deaths that we have at that moment. If we see specifically these first 4 or 6 months of the pandemic, really Colombia had few cases compared with other countries and few deaths compared as well with other countries. What happened?
insisto, hubo una cuarentena muy, muy fuerte.
There was a very strong quarantine. We were everyone in our houses without being able to go out. That made that first peak that you see at the middle of the red frame, it's reflecting some specific policies at the beginning of June of 2020. This was reflected in a very important increase of cases and deaths, and that is precisely that in that moment that where the experience that I'm going to tell you had success, was successful. What we thought, and from where did we start? It was very important to know that we were working with a healthy population, as we epidemiologists say. It is
hacer estudios en empresas, pues básicamente siempre mostramos una cara muy positiva porque pues precisamente el hecho de que
because precisely the fact that the people is working indicates us that it is well. We knew by the evidence that the available evidence that the exposition to the virus was bigger in homes or in public transport, and the work, it was a possibility of transmission because there was several workers, for example, when the work between two people were close, and when the ventilation was not enough. Under those premises, and we said, what do we want? We want to have a healthy work environment, and that so we can avoid the contagious and the transmission of COVID-19 in this work environment. According to Colombian legislation, when the cases start to appear, epidemiologist goes to that place and we see. So when we find a specific cluster, well, we say, let's close the company so we can make the research. And that was precisely what we wanted to avoid. And I can say you that we did have some outbreaks that detected before that the authority arrived. We have already taken decisions, and we were congratulated in several countries because they saw what we have done. This strategy had as an objective that the workers were healthy, that they were protected, to keep their productivity, without forgetting that we had to support the epidemiological surveillance that the government was implementing. The proposition basically has three elements. It's organizing the workers on social bubbles. The second one is the repetitive imperfect testing and isolating quickly and confirming with those tests. For those who would like to see more with more detail, this is the abstract of the article of the paper. Let's see the first element, the social bubbles. Where do we have to start with? We as human beings are social, and therefore we have relations with other beings at the work and outside the work. What we were interested in is that at least at work, they didn't have contact from within the different workers beyond the necessary. If you look
trabajo,
frames,
miren que hay una serie de interrelaciones
you
no
can see
únicamente
the
con
series
otros,
of
con otros
interrelationships
sociales,
between the
con los
workers.
mismos nodos, pero están unidos a través
They
de
are
esas líneas rectas indicando
they
que
are
ellos
linked
tienen
with
relación
these
como
lines,
tal.
indicating
Entonces
they
podemos
have to
reorganizar
relate
de alguna
themselves.
forma
We
el
can
proceso
organize them,
productivo
the,
dentro
the
del trabajo,
productive
tratando de
process,
que al máximo estuvieran
trying
independientes
that
unos de
they
otros,
would be
asociados. En
maximum
la parte de arriba, el cuadro de
isolated.
arriba, digamos, sería un muy buen ejemplo
The
de cómo
first
esos
frame,
mismos
it would
nodos
be
de
an
trabajo
example
fueron
how this
reorganizados para no tener
the
relaciones
workers were
interpersonales
reorganized,
necesarias.
so
¿Qué
they will
buscábamos con
be
esto?
just
Disminuir el número de
related at the
contactos,
necessary utmost
se disminuiría el
in
riesgo
order
de
to
transmisión
reduce
y
contact
obviamente
and
pues
transmission, and the risk of
está
transmission.
relacionado con
It
las
has to be
funciones que
related
tenía el
with
trabajador
all
dentro de su
the
proceso
functions
productivo. Entonces,
of
para
each
eso obviamente
workers in the
tenemos que
productive
consultar
process.
diversos ingenieros,
We have
diversos
to ask
encargados
some
y
engineers
las diferentes áreas o sectores empresariales. Y no solo
to
miramos
organize this isolation.
sino además tocamos
We not only see the areas,
en lo posible, no
but we,
cuando
we,
se pudo, se hizo,
we think about the
cambiar los
possibility
horarios de ingreso.
to change the schedules
de entrada a la misma
of
hora de la
times.
empresa, pues no podía ser porque había mucho riesgo en ese momento, o eso se pensaba sobre todo en esos primeros.
So we thought that entering at the same time was risky for all the workers. So we started to make staggered entries as well as breaks, meal times, and living times.
Pensar en los descansos, las horas de comidas y la salida también del trabajo que fueran diferenciales de tal manera que apoyáramos también que no se encontraran dentro ni en las inmediaciones del trabajo. Entonces, esto, digamos, es el concepto de burbuja.
This is the concept of social bubble
Si bien nosotros lo empezamos a
that
hacer en abril,
whether we started to make it in April, to apply it in April 2020, this later had more mathematical structure. We didn't name this as social bubble. It was already known like that. The practice that we do, we had to reanalyze all work processes, identify with the occupational workers of those companies. How can we do small groups to keep them isolated? We identify them by colors, some red, some green, some blue. So visually, they knew that they couldn't be together. And of course, for the surveillance was easier through colors. We follow all the biosecurity standard measures. And then we are going to the second element. We make some quick testing at the workplace to all the works and to all the small groups of workers. So each day there was assigned a day to make a test. And we have, of course, a result within minutes. So we want to talk to the second element, the imperfect repetitive tests. From the standpoint of view of medicine, we have always seen that diagnosis tests that we should choose in these cases would be the ones who have more sensibility or more capacity to detect a positive case. That would be the fundamental element. Nonetheless, we have to consider, and I think that there are differences between the countries, that COVID-19 diagnosis was not easy. We need that test, that PCR test, and that has to be the and A, and so we can amplify it.
Colombia, por lo menos los primeros meses, no teníamos completa capacidad.
And in Colombia, at the beginning of the pandemic, we didn't have the capacity to realize this test. This PCR test could be delayed around 9 to 15 days. That implied, and by the regulation of the health minister, that the people without the test should have to stay at home isolated. And while waiting, of course, for the result, it had high costs for the enterprises and for the economy in general. So this quick test would be really wonderful to have it. Another thing we had is to try to organize groups and to be able to replace the workers when they had a positive test. We can replace some activities relatively by a short time, but not, we couldn't keep it a long time. As I was telling you, this thing of this test has some reference at some high-level magazines where theoretical analysis and mathematical model showed that during a pandemic, it's much more important to have quick results and to repeat tests. That is more effective than to have the best effective test. So that as I told you, that this test, and this is something important, very important. We took the small group, the tests were made, and for example, let's suppose that it's a small group of 5 workers. They went, they took some blood tests. They took the blood of these 5 workers, and in situ, we could obtain the results quickly. If one, with only one that had a positive result, it obliged that all this small group, this social bubble, would be isolated in their homes. And so we went to the second step and asked the test, the confirmatory PCR test. We make this with blood test. It was around 48% to detect a positive case. Well, of course, if we have a case and we isolated the rest of the group and make the confirmatory test, we found that this test was not found. What can we say in this moment? Of course, sensibility of the test, the imperfect test, was improved a lot with this reorganization that we have in small groups. The sensitivity increased. We make a calculation. We found that we could get better the sensitivity up to 75%. So it was really interesting. This is a scheme that we can, that I remind you, it is in the article that I was telling you. the
tratando de identificar
traditional organization and
personas, trabajadores que están involucrados
the reorganization in small group and how each worker is related with each of all of their co-workers.
a través del resto de figuras más pequeñas que son
And these
precisamente
small
como
figures
burbujas sociales hechas por
are
el trabajo,
precisely
pues
the
cómo
social
se
bubbles
determinaba las
and how
acciones a
they can
seguir.
be determine all the
Cómo
actions
se
to
iba,
follow.
pasando cuando encontrábamos uno se le hacía la prueba confirmatoria y
So when we
seguía
find one to have a positive test,
trabajadores
how
cuando era
can we keep
requerido
testing to the other
Entonces,
co-workers
esto nos permitió, insisto, tener una
and determine whether they have
forma
to
de
be
medir
isolated or not?
y eso es lo interesante aquí que
And
quisiera que
the interesting thing here
crisis sanitarias como esta pudiéramos
for future
reflexionar
sanitary
en
crisis,
sentido interesante.
it's very important to
Creo que
reply
lo más
this
complicado de lo que dije tiene que
kind of
ver
this.
con
I think the most complicated of what I told
los grupos, digamos,
you
de
was
especialización
the
de bienes,
test.
pero hay algunas formas
There are some
que se hacen
ways
habitualmente, sobre todo en
that are
investigaciones
made,
muy grandes,
especially in epidemiological research.
lo que tenemos a la izquierda,
And
pues
what
lo
we
que
have at the
observamos es
left,
que tomamos muestras de
we
todas las
we
personas,
take tests of all the
ahora
people, of all the workers. At least it's a recommendation. We gather them together.
podría ser, le tomamos muestra de sangre a esos
For
cinco
example,
trabajadores,
a blood test of all these 5 works.
la mezclamos en una
We
única,
mix all
le
the
hacemos
bloods.
prueba de
We make a
PCR,
PCR
y
test,
sabemos si es positivo o negativo,
and then we
solo en el
know
caso de que sea
whether it is
positivo,
positive or not.
pues ahí
And
sí
if it is
tendríamos que
positive,
repetírsela a cada
we have
uno
to
de
repeat
individualmente. Es
the
una
test
forma de
individually to each
optimización
work. It is a way of
del método.
optimization resources.
Hizo la validación de esto y fue aprobado para que se hiciera
And in the university that I work, it was approved here in Colombia following the scheme that the university organized. This scheme is a way of optimizing resources when we want to make a diagnosis to a big population. And I would like to explain it more or less. At your right, we have the same workers. We make each test. Each was given the results, and if they were negatives, everyone was considered negative. But if only one was positive, we have to do it to all of them. Let's see the words. Time 1, time 2, time 2 of making the test would be 9 days in the Colombian case. And then at least we have to wait 18 days when we didn't have tests available tests. What we have done with a quick test that took minutes, all in the first phase, was important to have the certainty that all the workers were or were not infected. This saved us time, and the immediate action of isolating allowed us to have a company who had the capacity of remain active during the pandemic. It is important because there have been a lot of articles that has followed this topic. The one that I like a lot is that the quickness is more important than sensitivity in the tests. In this, we sent a letter to the editor of this magazine, and we told them that with the Colombian proposal and the incorporation of this, both the article and our experience make complemented the experience and improve international proposals. I believe that it is an experience that can be replied in other countries. And I believe it is important to have all these possibilities of low technological cost and very appropriate for countries that doesn't have economical and technological resources. enough resources. Thank you very much to all, and I leave you my email. Thank you very much.
Doctor, muchísimas gracias.
Thank you very much, Doctor, to share this experience in Colombia. It is clear that this kind of experience prepares us for future sanitary emergencies, as the one that we are facing in this pandemic. But also it is clear for us that the urgency does not always help us, and we have to prepare contention strategies based in science. This is very useful if we remember what Dr. Juarez was stating, the fourth actor in this. Some productive work groups, we had the opportunity to make telework and alternate days and possibly make these social bubbles, while some were working at the work center and others at their homes. In other industries or sectors, as the food industry, this possibility of teleworking was not real. Despite social dialogue is the central topic of this year, clearly it's not a new topic. And this is what we are going to discuss with our next panelist, Dr. Claudio San Juan, which proudly is active member of this commission, of our commission, American Commission on Occupational Risk Prevention. I'm going to read your CV. He is member of the Euro-Latin American Network for the Analysis of Labor and Trade Union, coordinator of the thematic axis of health and safety at work. He's a senior professional of the Superintendence of Labor Risks at the Ministry of Labor, Employment, and Social Security. He holds a degree in occupational health in Argentina since 2001. His master in labor law and his magister in labor law and international labor relations by the 13 de Febrero National University. He's a specialist in occupational health and safety at Latin American level, accredited by ALACET, magister in human rights, state and society by the 13 de Febrero National University, certified in the Academy of the Fulfilling with Standards in the Workplace by ILO. He's a full-time professor of the subject professionalizing practice of the career higher technician in hygiene and safety at work at the Instituto Superior Octubre, and former associate professor of the subject professional practice from the BA degree in hygiene and safety at work. He's former rector at the Faculty of Higher School of Safety and Hygiene at Work. He's linked with our American Commission on Occupational Risk Prevention since 2005. Doctor, please. Thank you very much, Javier.
Lo escuchamos perfectamente, doctor.
Bueno, gracias por la introducción, lo cual
Thank you for the introduction.
me ahorra algunas cuestiones vinculadas a la presentación del tema.
It saved me
Yo
some
voy a hablar en el marco
things related to the presentation. I'm going to talk
de este Día Mundial.
in the frame of this World
Voy
Day.
a aprovechar todo lo que es la participación y diálogo social para presentar la actualización de un documento.
I am going to present the actualization of a document that Javier, as Javier said, I had the opportunity to present on 2005 in our American Commission on Occupational Risk Prevention. What I'm going to try to tell you is basically an introduction of the situation of the participation of workers in occupational health and safety at work. defining a series of categories, as we have seen in the screen, which are the regulation, the principles of this participation, and what is the context and situation, especially in Latin America and in Argentina, especially because the government has sent a law project to the parliament. Finally, we're going to exchange some preliminary conclusions and proposals. All this would be the desirable. If I don't have time enough, I leave you the presentation so you can see it later. First of all, we will define participation as a process. We define workers' participation as a process of collective construction of information, training, consultation, and cooperation, which allows the exercise of the workers' rights in terms of health and safety at work. Where participation is defined through these interrelated categories or concepts. It is a indispensable minimum level and constitute an indispensable condition. Why? Because informative inequality makes impossible the communication. It is known as the right to know. In Argentina, this is regulated in a decree of 1979 in information and training. So it is an obligation of the employer to provide all the elements to the workers and all the information on preventive measures to avoid occupational disease and accidents at work. The consultation topic, Pérez and Laurent state, it's defined as the process to have the point of view of the workers, but keeping the decision in the employers. This represents the half of the participation, especially taking as a framework the European security. In Argentina, this right is partially included in the provincial laws in Buenos Aires and Santa Fe, and the sectorial decrees and resolution on mining of cable TV, and some the agreements as the mining one or the collective bargains agreements. Following the participation categories, we have the negotiated one. This is linked with the experience in Argentina is not very fulfilling. According to the dates, the database in a series of agreements that we took from 1973 up to 2009, out of a total of 6,236 agreements, we found that only 303 had clauses with health and safety commissions, 279 with clauses on use of personal protection elements. A lot of times the negotiations of the collective work are, for example, the employers and the workers
en otras normas legales que, bueno, se lo pone en la negociación.
They put in the
por
collective
ejemplo,
negotiation.
por mencionar algo, ¿no? Bueno, y el punto culmine de la participación es
And
lo que Boyce y Vogel señalan como
the last part of this negotiation is a co-decision. It's a participatory procedure in which the decisions are taken by a common agreement through a parity structure, and it assumes the highest level of the workers' involvement. These are basically the mixed committees of with resolutive character. They have also a consultative character. In Argentina, we have only two decrees. These committees that has resolutive character, the force on electricity.
Se nos fue un momento el doctor Claudio San
Dr.
Juan.
Claudio
Nuestra audiencia, vamos a esperar
left a bit.
un par de minutos para que se reconecte.
We will wait a couple of minutes so Doctor can be reconnected. If we have to suspend his presentation, we will be sharing his presentation in the links that Graciela Gil, our president, is sharing in the chat.
De la Comisión Americana de Prevención de Riesgos en el Trabajo. El vínculo particular que nos está compartiendo es justamente el de extensión, donde ustedes pueden encontrar las grabaciones de los de eventos similares a este que estamos teniendo en este momento.
Graciela Gil is sharing the link of our microsite with the specific links of this presentation.
De su sitio. Doctor, bienvenido de vuelta.
Doctor, welcome again. Oh, thank you.
Vivo en una ciudad que tiene
I live in a city that has some connectivity troubles. It's not Buenos Aires.
Local tampoco es un orgullo vivir en Buenos Aires, pero suele ocurrir.
Entendido.
Bueno, it's normal.
Justo estaba terminando la parte introductoria lo que tenía que ver con las categorías de participación.
So I was talking on participatory categories. I'm going to go mentioning other two participatory categories, that is workers' control. Basically, there are experiences from the Italian workers' model, with the constitution of the Workers' Health and Safety Control Commissions. This is a challenge that Gaston Emari proposed, one of the forerunners of the workers' model. And he says that recovering the control of the harmfulness in the working environment, it is our weakness that, while we could have conquered the theoretical, practical hegemony over the control of environmental noxiousness, we have returned to the old conception that today characterizes the community directive and the new legislation. The workers' tasks in terms of occupational safety and health, it's a measure that consists of refraining or refusing to perform work tasks when there is a danger to the health and safety of the worker. This is a light that was stated in the labor contract regime.
Bien, y para pasar al tema siguiente, respecto a las normas y principios.
So the next topic is the standards, regulation, and principles on participation. I'm going to leave you especially three agreements linked. The agreement 155 of the ILO, the recommendation 164, the guideline concerning occupational safety and healthy management systems, also from the ILO of 2001, and the Social Liberal Declaration of Mercosur in 2015. Article 20 of the 155 agreement established the cooperation between employers and workers as an essential element. In the case of the recommendation 164, it is expressed with more detail of the constitution of the committees, the parliamentary committees. And the ILO 2001 said that the workers' participation is an essential element on the management system in the organization. We have also the Mercosur's declaration, which states the participation of the workers and employees at the enterprise level with the objective of preventive accidents and diseases. As Dr. Hill said, there are several organs and members that organize these laws and regulations. Regarding the participation on America Latina, almost all Latin American countries except Argentina has participating mechanisms, mandatory participating organisms. Here there is a resume and you can see it with more detail at the publication that I said before. This participation mechanism has several names and several figures. For example, committees, commissions. In the case of the preventionist case, they are called supervisors. To finish, this is a topic that I was more interested in sharing with you, is a project to the Argentinian parliament to create mixed on occupational safety and health committees. It's a draft law. The presentation has this structure. I selected the most important institute of the law and make some commentaries according to the already existing law in Argentina. These are the presentation data. The project actually is in the Commission of Law Legislation. After discussing in this commission, it goes to another commission to discuss the law. In Argentina, we have 39 years of democracy. There has been always presented law drafts, but this is the first time that the executive national power it's the first time that the national executive power presented to the parliament. The structure of the bill, of the draft bill, is very similar to the other draft laws at the regions in Argentina. And it's the Joint Committee on Occupational Health, Safety, Environment and Risk Prevention, definition, election of its member, functioning, competence, power, etc. The first point is the right of consultation. The draft defines a Joint Committee for Safety, Health, Environment and Risk Prevention at Work, and and it is determined by the size of each enterprise.
El segundo artículo
The second article
prevé la elección
provides the election
participantes del comité
of the members of the joint committee
del punto de vista de parte de los trabajadores.
the
Acá también tiene
workers' representatives.
una diferencia respecto a la constitución de los comités mixtos del resto de Latinoamérica, ¿no? Acá los participantes no son
Here, the participants are not elected for the direct vote of the workers, but they are elected through delegates of the unions that the majority of the workers are affiliated.
Bueno, acá también trae el instituto que hablábamos antes, el derecho de retención de tareas.
Also, we have the right to refuse an order to resign.
De procedimientos que no están
There are some procedures that are not harmonized with the updated legislation.
Acá dice que el comité puede intervenir
Here it said that the committee can
en el
intervene
caso de un riesgo grave inminente
in case of a real risk
Eso hay un derecho
to the safety and health of the workers.
cuando la legislación de fondo dice otra cosa, ¿no? O sea que cualquier trabajador o trabajadora puede retener las tareas en un caso de riesgo grave inminente. ¿Sí?
So in
La negociación colectiva
the collective negotiation is the axis in those places where there are less than 100 people, workers. The collective convention could create a mixed committees.
Bueno, y acá también traigo a colación lo que decía el doctor Aldao Sapiola.
Here I
Que dice, se toma
also
convenio, la mayoría son bastante pobres.
said what Dr. Aldana said. If we take agreement by agreement, most of them are quite poor in their content, and in some cases, they even repeat themselves, even with the same norms contained in the basic law. This is the comparative scheme with the provincial updated laws. The minimum number of workers to create a mixed committee is 50 workers.
Las provinciales entre 10 y 49 tienen derecho a
between 10 and 49 workers, they have the right to create a committee that is also elected, that can be also elected. Between 10 and 100 people, this mixed safety and health committees and for the prevention of risk at work can also be work. To finish this with preliminary conclusions and challenges. In Argentina, there is explicit standard law on information, consultation, and participation of the workers. Beyond that, a lot of the things that this law is proposing, they are already in the existing laws. Orsatti states that beyond negotiation, this standard help to generalize occupational risk prevention measures, including the prevention of violence, harassment, and discrimination. Part of the competence our included in the Article 43 of the law of the Trade Union Association. The seventh law has requires an harmonious interpretation and a 75 on the tasks of the workers. Which are the challenges?
respecto de la
keep
participación
promoting an
de los
exchange
trabajadores en
of
áreas de salud y seguridad en trabajo.
of communication of the
Americana, trabajo como en otros foros. A la par de este tema que nos convoca, se nuevos
new challenges presented in this safety and health at work, as such as the agreement 194 of sexual harassment, the evaluation of psychosocial workers' risks, and, and articulation of the legal norms, healthy work and environment. We have to think all of this from within a holistic integral focus. The only thing I wanted to share, I also share the link of the publication. Thank you very much for the patience, for the invitation. We keep in touch. Thank you very much, Javier. Thank you very much, Graciela. Thank you very much, Doctor, for your speech. We thank you very much to share your experience. Dr. Maestra Paula Alvarez was talking on the experience and the strengthening of this participatory mechanism on social dialogue that you have in Argentina. And I hope that this speech of Dr. San Juan serves us to show why precisely it is an example at the same document that I just shared in the chat box from the ILO document in co-authorship with Maestra Carmen Bueno. With this speech, if we don't have any questions or commentaries,
de las ponencias, correcto, doctora. Veo su comentario también. Háganos llegar sus inquietudes. Visiten nuestros micrositios, por favor.
Go through our microsites. You can find all the information that we have shared in these 2 days as well. I thank a lot our 5 experts, our authorities, our special guests. But above all, we thank our audience who have accompanied these 2 days to receive this 28th of April, the World Day of Health and Work. If there are no any more questions, we will be closing these 2 sessions of our contribution.
Ok, perfecto. Perdón, es que sigo leyendo sus comentarios.
I keep reading your commentaries.
Para dar arranque a esta conmemoración del Día Mundial
to commemorate the World Day for Safety at Work, Health and Thank you very much to our panelists. Thank you very much to our audience.